Thank you. Our Vice Chair, gentlewoman from California, Ms. Katz.
Thank you, Mr. Chairman. I'm very pleased that the subcommittee is meeting on this important subject. I thank the panelists in advance for being here today and for the testimony you will be giving. The reauthorization of the Ryan White CARE Act is a critical issue for this committee, for the HIV/AIDS community, and indeed for our entire country. I look forward to a productive discussion today about how we can focus on the ways we can strengthen the CARE Act so that it continues to meet the health needs of persons living with HIV disease and their families, especially as they are living longer, which is a good thing. This issue is especially important to my home state of California, as my colleagues who are from the same state are here as well, which has the second largest disease burden in the United States and a significant number of new cases each year, particularly amongst the Latino population. As you know, California is experiencing a severe budget crisis. State AIDS funding has been drastically reduced. My constituents and all those affected across the state need this assistance from Ryan White more than ever. Too often their livelihood and that of their families depends on this care. I want to associate myself with the remarks of my colleague from Texas, Dr. Burgess. As one who also represents portions of a rural area, 3 mid-sized counties on the central coast of California, I'm concerned that funds are disproportionately assigned to more urban areas. I represent the main source of HIV services between Los Angeles and San Francisco, and I want to ensure that Central Coast providers have what they need to provide resources. September 30th will be here before we know it. We must act now to reauthorize this legislation. I'm interested to hear from our panelists today about how we can work together. And we can work together in a bipartisan way, I believe, on this committee to ensure that the thousands of members of our HIV community in California and across the country continue to receive health care and support services. Thank you for your testimony, and I look forward to hearing it. I yield back.
Thank you.